The theme of this unit is the definition of mental disorder and the classification approach of the psychic and behavioral phenomena that lead to distress, disability, discontrol, and dysfunction. As a clinician, it is important to be aware of the range of difficulties which your clients may present to you and to be clear about how you understand the nature of these difficulties. I suppose one of the basic questions in the field of psychopathology is the definition of mental disorder. Our answer to this question drives our assessment and treatment processes. This definition also serves as a bridge between clinicians and researchers. At a societal level, this definition impacts reimbursement, eligibility for various services, and often plays an important role in both civil and criminal legal proceedings. I believe your definition of a mental disorder is a central part of your professional philosophy. The Diagnostic and Statistical Manual, published by the American Psychiatric Association, is the diagnostic system used in the United States. A new edition of this manual, DSM-5, was published last year, and we will focus on this classification system. It is available to you online. We will also be looking at the differences between DSM-5 and DSM-4 and introducing you to the ICD-10, the International Classification of Diseases, 10th edition, which is published by the World Health Organization. We are also going to be covering the perspective of individual psychology of Alfred Adler on psychopathology, and we are going to look at emerging transdiagnostic approaches to psychopathology. We will consider how cultural factors are integrated into our understanding of psychopathology and of the person, and briefly consider the evolution of the DSM through the 6 volumes that have been published so far: DSM-1, 2, 3, 3R, 4, and 4TR. ICD-10 is the 10th revision of the International Classification of Diseases manual, which is published by the World Health Organization. It codes diseases, signs and symptoms, abnormal findings, and external causes of injury or disease. Over 16,000 different codes are defined. Most of the care providers in the world use ICD-10. A few countries have made modifications to better accommodate its use. This year, in the United States, the Centers for Medicare and Medicaid Services adopted an ICD-10-CM, standing for Clinical Modification, which will officially replace ICD-9 on October 1st, 2014. ICD-10 is divided into 22 chapters, each designated by a letter. The 5th chapter is on mental and behavioral disorders, designated by the letter F. The chapter is further divided into 10 sections, which are listed here. Each section is further divided into diagnoses, and some of these have types and specifiers. For example, F20.23 is catatonic schizophrenia, episodic with episodic remissions. The F designates the mental and behavioral disorders chapter. 20 is schizophrenia. Point 2 is catatonic schizophrenia, and the 3 is a course specifier. There is a list of the diagnoses for you to download. ICD-10 has a set of diagnostic criteria that are somewhat different from the criteria for DSM-5, so there is not always a direct correspondence between these two classification systems. It would be a good idea to browse the DSM. Notice the chapter titles, the 20 broad categories of mental disorders. Find the glossary toward the back of the book. I encourage you to consult it regularly, as well as the vocabulary page that you can download for each unit. Next, look at several specific disorders, noticing how the content is laid out. After some introductory remarks for each chapter, there are specific diagnostic criteria for each disorder. There is a discussion of the diagnostic features, associated features, prevalence, development and course, risk and prognostic factors, culture-related issues, gender-related issues, suicide risk, and functional consequences for each disorder. There is also some guidelines for differential diagnosis and some comments about comorbidity. There is a great deal of information for each disorder, a synthesis of the current research on this disorder. Compare some of the diagnostic criteria from DSM-4 to DSM-5. Many of the disorders have the same name. Are the diagnostic criteria the same as well? Chapter 1 in our text discusses some basic issues in the study and classification of mental disorders. I encourage you to pay particular attention to their discussion on defining mental disorders. For this unit, we are reading an article by Alfred Adler that defines the individual psychology view of psychopathology and psychic life. As you read, listen for the definition of mental disorder and for the way Adler approaches the classification and categorization of people. Do you notice any differences between Adler's views and the definition of mental disorder from the textbook? Gemeinschaftsgefühl, which has been translated as social interest, social feeling, or community feeling, is the criterion for mental health in the individual psychology of Alfred Adler, and can be considered a growth or self-actualization motivation, or to use the individual psychology terminology, a constructive line of movement. The Ansbacher article identifies an object dimension, that is, the objects towards which the interest is directed, and a process dimension, the interest itself. Mansell et al. Define the transdiagnostic approach to psychopathology. We will be exploring several transdiagnostic processes through the course: perfectionism, repetitive negative thinking, shame and guilt, and emotion regulation processes. Pay attention to Table 3 on page 11, which defines several different types of transdiagnostic approaches to the field of psychopathology. In the recommended reading, Barlow and Durand give some history and define a number of terms that are useful in studying people's distress. They call their approach an integrative approach because they attempt to integrate social influences, biological influences, behavioral influences, and emotional and cognitive influences into their conceptualization of the person. For this unit, I would like you to compare and contrast the definition of a mental disorder in DSM-5, the textbook, and individual psychology. Your original post is due on January 7th, and your peer responses are due on January 8th. Remember that your task in the Compare and Contrast forums is to identify and discuss similarities and differences for the topics of the question, and to define your professional position. You may agree or disagree with one of the positions, or you may define your own position. Peer responses on these forums will bring another aspect to the discussion, add a new light to already offered ideas, find additional scholarly support for your classmates' position and demonstrate that you have done some good additional reading on this issue, reply to a group of your classmates by comparing or contrasting their stated positions, or probing, offering a counterthought, or integrate your classmates' observations into your original position, whether supportive or not. There is also an extra credit question for this unit, which you can complete any time before January 27th. Critically evaluate the DSM-5 cultural formulation interview by administering it to a friend or a colleague. You can also earn peer response points by responding to the posts of your fellow students on this forum. Peer responses are due by February 5th.